Welcome to Bariatric Business Accelerator, the podcast created for busy weight loss practitioners and their teams who want to systematize, simplify, and accelerate the growth of their new or existing weight loss practice. I'm your host, Karol Clark, and today I want to reflect on 2024, which really was a pivotal year for weight loss practitioners and their teams. And this episode is all about the lessons that we learned, what worked, what didn't work, and how we can move forward even stronger this year and beyond. So whether you are a seasoned practitioner or just starting out in the field, because I'm working with a lot of people who are opening up brand new practices, I'm excited about that. I'm confident that you're going to find valuable takeaways in today's discussion, so I want to dive right in. The first thing I want to address is how we all were required to navigate the market changes. So for market changes, 2024 was a year of economic uncertainty for many. Inflation impacted our patients, both their ability to afford services and also from a practice perspective, our operating expenses. So many practices had to adjust their pricing models or offer flexible payment plans to maintain accessibility for their patients. They had to really search to make sure that they were able to help make things affordable for their patients and while also containing costs in their practice. We also saw major developments, of course, with the anti-obesity medications, particularly GLP-1 medications. There's so many changes going on regularly as we navigate forward, and 80 more new ones coming out in currently with the FDA for evaluation. But while the medications continue to dominate conversations about medical weight loss, supply chain issues, as you know, we all experience this, pose challenges for both patients and for providers. It was almost like a full-time person to navigate that. The lesson there is clear communication and setting realistic expectations with our patients is absolutely critical. From a technology front, many practices had to adapt new tools for patient management and marketing. I help people implement very efficient patient tracking from lead all the way through to a patient. It was very exciting, the things that are available nowadays. Whether it was software to streamline their operations or social media campaigns to attract more patients, we learned the key is a bit of balance. So technology enhances what we do. It makes it easier, of course, but we don't want to replace our personal touch that we bring to patient care and to attracting patients into our practice in the first place. The next area is evolving patient expectations. Moving on, patient expectations this year, there was a noticeable shift in what patients wanted from their weight loss journey. Education and transparency really became more important than ever. Patients aren't just looking for quick fixes. They want to understand their options and feel empowered to make informed decisions. On the other hand, some people were getting such great results from the anti-obesity medications that they really didn't want any other education. They just wanted that magic pill, that magic injection. We also saw the growing importance of addressing emotional and mental health in weight loss. It's much more of a comprehensive aspect. And resistance to behavioral counseling is still a barrier, as we all see, but practices that really integrate psychological support into their care plan reported better patient outcomes, of course. The big takeaway, weight loss is about more than just the physical. It's about treating the whole person. That's why we see, food as medicine really coming onto the forefront and lots of other changes in that area. I could do a whole podcast on that alone. The third area, business and practice management. Now let's talk business. I love to talk that. Marketing was a huge focus in 2024, and we learned a lot about what works and what doesn't. And we found that just as I taught for years, direct-to-consumer marketing campaigns tended to be the most effective, but so was physician outreach and brand building, which oftentimes we can kind of put on a lower level there. And while building strong referral networks remains a cornerstone of growing your practice and establishing new partnerships is really an area that was exciting this year. I think new partnerships became a new strategy for success because everyone was in sort of the same boat, but we had to help each other out. Staffing and team development stood out as another area in 2024. Practices that truly invested in their teams through training and fostering more of a collaborative culture, including them in your goals and how to get there, not only improved patient care, but it also boosted morale and retention. It's not just about the money, even though that's a big part of it. And then let's not forget revenue diversification. So from e-stores, which are very easy to implement nowadays for meal replacements and other complementary services in your practices, that proved to be a smart move for many practices for diversification of revenue streams. And one of my favorites, cash pay services and products, really help to innovate and keep revenue steady for so many practices that I work with. Finally, I'm a metrics girl. Metrics remain, for me, the cornerstone, a necessity for determining, what's working in your practice and coming up with effective strategies rather than just following trends or misguided initiatives. So metrics is still a huge part of being able to move forward strongly. So finally, professional growth and resilience in 2024. It was a year of personal and professional growth for many weight loss physicians. We all admit to that, and myself included. Adapting to uncertainty became a recurring theme, so we all had to be very resilient. Practices that embraced flexibility, whether it was in their treatment offerings, their pricing models, their patient care strategies, they found themselves better positioned to handle unexpected challenges. So collaborating with others in the field also played a key role. I saw more collaborative relationships, and I really want to integrate that more into my membership too. So whether it was through conferences, webinars, peer discussions, sharing knowledges and experiences, that really strengthen our community, I think. Sometimes we like to hear what's going on, so I like to share that with other practices. And on a personal level, many of us learn the importance of managing burnout. Burnout is a real thing, and staying connected to our own passion for patient care and improving the health of our patients, while at the same time trying to balance business requirements. This happens for me too. I got away from my personal care, and I've really been back into it here in 2025, and I'm so excited about that. I feel so much better. So remembering to take care of ourselves is just as important as taking care of our patients. And then looking ahead to this next year, as we look ahead to 2025, there's several areas we can continue to grow. First, let's continue to build on the lessons that I just shared from 2024, strengthening those referral networks and those partnerships, refining your marketing strategies, adding your own views into that, and not in a difficult way. We can use AI to a certain degree, but it has to have your voice. And keep exploring ways to enhance patient engagement. There are so many tools, and if you want to know of some of the most innovative ones, reach out to me. Innovation will always be key, staying open to new ideas and technologies that can improve your practice. And most importantly, as we all know, we want to keep a focus on patient care, because at the end of the day, of course, their outcomes are what matters most, and that's what's going to bring you more patients. That brings us to the end of today's episode. 2024 was a year of challenges, but I saw so many practices starting from the ground up. I helped them, and they're starting to thrive. Those that were kind of struggling, we looked at where to hone in their efforts, and it really has been something exciting. So take these lessons, let's move forward and make a positive impact, continue to in the weight loss industry. And if you found this helpful, I encourage you, if you would, please share it with a colleague of yours. And make sure you subscribe so you never miss an episode. And I appreciate you so much for tuning in to Bariatric Business Accelerator. If you're one of my membership clients or someone that I'm working on from a additional personal practice development, I appreciate you so much. And if you would like just an opportunity to just sit down and talk about what's going on in your practice, I'm always happy to do that. Complimentary, you can reach out to me, Karol, Karol, at weightlosspracticebuilder.com. Thanks so much again for tuning in. Take care.